Now, so how does AI actually make sense of all of this healthcare data? The process is different depending on whether you are dealing with structured or unstructured information. And I think we talked briefly about that in the last video, but let's talk a little bit more. In structured data, the features, the individual pieces of information that matter are clearly defined. The AI knows that heart rate, blood pressure, temperature are separate. They're separate measurable variables. It can analyze relationships between these values and patient outcomes relatively straightforwardly. They can say, okay, high heart rate, okay, that's bad outcome. High blood pressure, okay, relatively straightforward. High blood pressure is bad. Temperature high, straightforward, that's an infection happening, right? But with unstructured data, AI has to first figure out what features matter before it can actually analyze them. Now, this is where natural language processing comes in. Now, we all know about ChatGPT and natural language processing, but this is about healthcare. And this is how natural language processing will be used within healthcare. And I'm going to have dedicated videos on how we can actually do it ourselves, implement this, and make our models and what we need to learn about those models. Now, let me give you an example. Suppose you feed an AI system thousands of history and physical notes. That is when the patient is admitted to the hospital, right? For example, along with information about which patients ended up in the ICU. So over time, what will happen is that the AI learns that certain phrases correlate with an ICU admission. Oh, the patient is toxic. The patient's blood pressure is low, perhaps. The patient is somnolent. The patient is confused. The patient is not responding. All of these terms come into the mix. It might also learn terms like altered mental status, the respiratory rate is greater than 30, or the patient is tachycardic. These are all predictive signs of deterioration, that the patient is getting worse. So the AI isn't just looking for these exact phrases, it's learning the clinical concepts that they represent. Now, AI will correlate these terms and these terminologies with ICU transfer or ICU admission, right? Let's say, for example, in medical imaging, the process is even more sophisticated. Deep learning models, and we talked about that previously, so deep learning models don't just see pixels. They learn to recognize patterns that indicate disease. A model might learn that a hazy patch in the lower lung fields might suggest pneumonia, or that certain patterns in a mammogram might indicate malignancy versus being benign. So what's remarkable is that these AI systems sometimes identify patterns that even experienced clinicians might miss, or they may be in too much of a rush to actually look at that in detail. And a few things that a human may miss, they can detect subtle changes in imaging or finding combinations of clinical factors that sometimes humans cannot predict clearly. But AI may be able to pick that out much more quicker. But here's the crucial point, of course. AI systems are only as good as the data that they are trained on and the clinical expertise that is derived from the data that guides this development. This is why being the human in the loop, your understanding of how AI processes healthcare data is so important, and why a model will fail in your clinical setting or it has the likelihood of succeeding and actually being valuable in your clinical setting. Now, to recap how AI understands healthcare data, AI processes healthcare data differently depending on its structure and format. Now, the structured data. In structured databases like lab values or vital signs, the features are clearly defined. The AI can directly analyze the relationships between these values and outcomes. However, for unstructured data, with unstructured data, such as clinical notes, AI must first identify what features matter before it can analyze them. Clinical example, as we discussed, large language models analyze thousands of history and physical notes, and they learn terms like altered mental status, respiratory rate, tachycardia, and they correlate with, let's say, for example, an ICU admission. Now, in imaging, on the other hand, deep learning models don't just see pixels. They learn that a hazy patch in the lower lung might represent pneumonia. Dear all, I hope you are doing great. and that you are liking these lessons and you are enjoying and you are learning. And I did want to suggest something as an option for you. Only if and only if you are one of those who want to have this content in a more organized manner, there is a program that I have set up that you can find in the description. It absolutely is not necessary. However, it is only for those who do thrive in an organized approach, and there just might be a few more goodies there as well. Anyways, I wanted to share this, and now back to the video. Now, how do we get healthcare data, and how do we prepare data to be used to train AI models? Now, it goes through an extensive preparation process, as you would have understood from the previous bit of information, that the data needs to be good. So understanding this process helps you appreciate both the power and the limitations of healthcare AI. First, there's data collection. This might come from public data sets like the Mimic3, and which is a large, freely available database. And another example is PhysioNet, which I believe was prepared by the NIH. And these are anonymized collections of ICU data used for research. Or it might come from your hospital's own electronic health records or your PACS system for images. So increasingly, we are also seeing data from wearable devices, ventilator logs, because all of these are being connected with Internet of Things, where data can be extracted from all types of machines. And then even such as infusion pumps, IV drips, everything. And I think I gave an example of these things in the previous lesson. So next comes pre-processing. This is like preparing ingredients before cooking. For structured data, this might mean normalizing vital signs, for example, and I'm going to just show it to you right now how this is done. So let's say converting all pulse, heart rate measurements from a standardized scale to a normalized scale. I'm going to show this to you right now. For example, mapping a pulse rate from 30 to 150 beats per minute to a scale of 0 to 1. Now, this is exactly how the computer is going to look at it. Now, if you look over here, this is your heart rate, 30 and 150. Now, when you normalize it, you have 0 over here, and you have the one whole number, 100%, 1 over here. Now, between these values, you may have, let's say, 75, right? So let's say 75 will be 0.5. Below that will be 0.2. Then over here, it goes 0.75. So this is called normalization. Now, for unstructured data, such as clinical notes, the pre-processing involves natural language processing techniques that convert text into numerical vectors that AI can work with. This is where the computer learns that SOB and shortness of breath refer to the same clinical concept. So this is where natural language processing comes into the mix. For medical imaging, perhaps, the pre-processing might involve having radiologists annotate or label images, marking regions of interest or confirming the diagnosis. Oh, this is pneumonia, this is where you see it. This is a nodule, this is where you see it. So that's what radiologists will do. Now, then there's a crucial step of bias checking. Now, this is where we ask hard questions about the data. Is your data set, and we can ask these questions to any vendor who is bringing in a product. Is your data 80% male patients? Is it 90% white patients? Are certain conditions overrepresented or underrepresented compared to your actual patient population? So you have to know, hey, your patients are, let's say, 50% female, 50% male, but this vendor's AI is being trained on 80% male data, then of course that won't work. Because if the answer is yes, that their model is not ready for you, then your AI will reflect those biases unless you actively correct them. And this isn't just a technical problem, this is a patient safety and a health equity issue. Now, finally, there's labeling. As we talked about before, that labeling is the outcome. Pneumonia, right? Pneumonia is an outcome. Lung nodule, that is an outcome. So labeling, which means that telling the AI what outcomes you want it to predict. For a sepsis prediction model, you might label patients based on the SOFA score, the SOFA scores, or the specific ICD-10 codes. For imaging studies, radiologists might mark regions that show the pathology. Now, interestingly enough, New AI tools like the large language models we have these days can actually help in labeling in this labeling process. They can automatically identify relevant clinical concepts in unstructured notes and make this task much quicker and much faster to get your pre-processing ready for eventual use. And the key point here is that data preparation is basically where clinical expertise becomes absolutely essential. This is where subject matter experts come into the picture. And the point to note is that you cannot properly prepare healthcare data for AI without understanding the clinical context and the real world implications of the decisions that the AI will make. So, getting this right in this first step is hugely important. Now, to recap so that we understand this, data collection could be public databases, private, your own EHR, or from devices, wearables, ventilator logs, etc. Now, pre-processing is very important. You need to do normalized values, and we gave an example right over here. You have to convert nodes into numerical vectors. Down the line, we'll talk about that, how to do that. Annotate imaging with a radiologist's input. Of course, you have to check for bias. Don't think of this as anything else, anything political. This needs to be done, otherwise your AI will not be effective. If your data set is 80% male and 90% white, is that your representative population or is it not? So are certain conditions over or underrepresented? If yes, your AI will reflect that unless you correct it for this problem. Now, labeling is important. Labeling means that you have to accurately label the outcome. Let's say for sepsis prediction, label patients based on scores. For imaging, radiologists mark regions of interest. And tools like ChatGPT can help pre-label unstructured notes. I have this chart here that if you have biased data sampling, biased cleaning and processing, biased labeling, and you train the model, you will get biased AI outcomes, and we don't want that.